Assalamu alaikum, everyone. Welcome back to another episode of the Medical Talk. Today, we have a very special guest with us, Dr. Hamza Hashmi, who is a myeloma specialist at Memorial Sloan Kettering Cancer Center in New York. And I'm very glad that we can have him here. He is originally from Pakistan. I'm very excited to have a conversation with him today. Thank you so much for joining us, Dr. Hashmi.
Oh, thank you for having me here.
What was your early education like? What was your early life like? I believe you're from Lahore originally, if I'm not wrong. So I wanted to ask about that and how did you get to the US and became a myeloma specialist? What was that journey like?
I was born and raised in Lahore. Um, I come from a family of physicians with my father and my brothers being all in medicine. I was the youngest of all,
Yeah.
so there was always a path, a holy path carved out for me to be in medicine. Um, I got into King Edward Medical University, and even early on in my medical school, uh, being in the company of my friends and importantly my older siblings who were planning to be in US, I knew that I wanted to come to US and embark upon a journey of USMLEs, residency fellowships. Um, and I, in the last year or so of my medical school, started looking for elective rotations in
Mhm.
US. And by the time I was about to graduate after my final exam, I actually came to US for elective rotations. And at that time, I think I was pretty convinced that US is where I want to pursue my training, my career, and my life.
Yeah. That makes sense because I feel that you had older siblings as well who you were inspired by and had that path in front of you. But was it difficult to get elective rotations at that time? Because it is difficult in the current situation, especially with the entire visa situation. Was it difficult for you? And what advice do you have for students who are looking for elective rotations and observerships?
I think it was difficult, perhaps not as difficult even in those years back in 2010 to secure elective rotations and observerships. I do believe that applied to 100 plus institutions. But eventually it was a friend of mine,
Yeah.
in fact, a senior colleague at the medical school, who gave me some very valuable information regarding one of the Pakistani physicians at a major academic center,
Yeah.
where I could actually explore the opportunity of getting an observership or elective rotation. So yes, I did apply to a lot of them. I did get rejections from some of them. I never heard from many of them, and I think eventually it was one kind soul who uh, uh, decided and agreed to take me or sponsor me for an elective rotation. I did elective rotation at University of Massachusetts, and at that time, I did rotations in endocrinology and hemonc as an international medical student. In regards to your second and your third part of your question, um, I agree that it's becoming increasingly difficult. I think with the increasing number of graduates, competition, US graduates who are actually also wanting to do these rotations.
Yeah.
Political circumstances have also evolved over a period of time that makes it more challenging to do so. I think in these unique circumstances, as long as you have some sort of an experience, whether it's observership or an elective rotation, I don't think there's a huge difference between the two. You should aim, of course, for elective rotation where you can actually not just be an observer, but also interact with the patients, uh, go to the patient bedside, see them, examine them, sometimes write notes, provide assessments. That way, you don't only get better experience of the US healthcare system, but also, in fact, you can actually secure better letters as well. But having said that, if it's also an observation, I think there's so much that you can do with an observation as well. If when you're working with some of the physicians, that shadowing them, working with them, seeing patients with them, sometimes even and presenting to them, you can make the best of whatever opportunity comes your way.
Yeah.
Uh, when life gives you lemons, you have to find a way to make lemonade. So I would say that either one would be appropriate. My own institution, which is
Yeah.
it's one of the leading cancer centers in the
Yeah.
world, including US. I have observers. I don't have folks who do elective rotations.
Mhm.
An observership means that they make rounds with me, they see
Yeah.
cancer patients with me in my clinic.
Mhm.
Um, uh, it really and truly depends on the level of engagement that the observer um, intends to have. You can look patients up, you can present history, you can ask good questions, you can read about it. So I think all of those things matter, rather more than whether it's an elective rotation versus an observership.
Yeah, that makes sense. And apart from electives and observerships, there's a lot of questions we get on the medical talk about postdoctoral research positions. That is something that I also have questions about. And some people are now aiming to get postdoctoral research positions, do around 2 to 3 years of research, and then move on to residency and go towards the physician scientist pathway. So, what is your opinion on the physician scientist pathway and about postdoctoral research positions?
I think you very rightly pointed out that uh, it's perhaps more difficult than observership and elective rotations to actually procure a postdoc research position, especially now in current political circumstances. There is a lot of funding cuts to
Yeah.
NIH and grants and in major institutions that has affected actually postgraduate, postdoc research position all across the board, not just for foreign medical graduates, but for, in fact, for American citizens and residents, that it's becoming astronomically difficult actually to find a place where you can have a position. If there is a position, it's very likely going to be without any salary or without any financial support, which can make it very challenging to be on a visa and be able to work for 2 to 3 years without any salary or compensation, to be able to support yourself in big expensive cities where all major academic centers are. So I think it's perhaps a track that has may have worked in the past, but it's becoming increasingly difficult,
Yeah.
especially in the current circumstance. So it may change in the next, after a couple of years, once there are maybe the funding cuts are not as severe as it are in this administration. But I think for now, it's going to be very difficult to do that. Having said that, let's say you are able to procure a position with a postdoc research. Um, I I do think it really helps you narrow down your career focus. For instance, if you're a person who really wants to be a cardiologist or an oncologist and you do a postdoc position in a lab, either with cardiology or for that matter, oncology, it will affect your ability to actually pursue your goals. Where it make it easier for you to get into residency, get into fellowship, get hired as a faculty, primarily because of your research work and research efforts that you have made in the past. I do know some friends of mine who have actually tried doing this. And I think one of the things that I've seen happen is that oftentimes when applicants are not able to find residency positions, they go into postdoc positions, they spend 1 or 2 years, a lot of their work is unpaid, it becomes financially challenging, and when they enter into residency through the track, they don't have any interest in that particular field. They don't have interest in oncology, they don't have interest in cardiology, they want to do something else. So um, I think there can be some better ways around it. If the goal is to get into residency, there can be paths that are not as hard and difficult, uh, rather than just doing a doc position. So if you're someone who really wants to be who really wants to look at immunotherapy, let's say for multiple myeloma,
Yeah.
doing a postdoc for 2 years will really set your career for success.
Yeah.
But if that's not what you really want to do, which many folks don't have an idea, many students don't really know what they want to do 10 years from now, I don't know if that's the right track.
Oh, that makes sense because obviously once you get into a postdoc, for instance, in cardiology, and you, as you said, do a residency in internal medicine, and then during residency realize that you really don't want to do cardiology, then it's going to be a difficult situation. Apart from postdocs, we were talking about observerships and clinical electives, and you said that you get a lot of students for observerships. So what do you as an attending look at in students when they're observers in your hospital, in your clinic, and what are some of the qualities that you look for, and what are some of the things that you would want to share over here that we should not do as observers?
I have been an observer and done elective rotations myself, so I remember
Yeah.
from my days as well how much anxiety can be around that
Yeah.
experience. Um, I think being consistent,
Mm.
being punctual, uh, being respectful is very important.
Yeah.
Which means that if you have reached out to a particular institution, a physician, uh, expressing your interest for the rotation, and they do sponsor you and agree to take you on
Mm.
as a student, you should then follow through with
Mm.
that request. Um, and
Mm.
when while you are here, when you are working with them, it's very important to show engagement. Um, and when you engage, you don't just always engage with a physician that you're working with. You engage with a patient, you're engaging with nurses, you're engaging with other staff member that has resident, that has fellows. It's important to have some people skills. It's important to have some good communication skills, be respectful. At the same time, show interest. I think it always um shines light on you as a candidate when you are taking interest and showing interest. You are showing up on time, you are reading up on the patients, you actually take the initiative of saying that, can I see this patient before you do? Can I present it to you?
Mm.
And at the same time, without adding additional um, uh, workload burden on the physician who's
Yeah.
perhaps seeing 20, 30 patients that day. I
Yeah.
think it really helps. What I've found myself to be a really key uh, uh, feature in a star candidate is that they take initiative. They
Mm.
show up on time, they will read up on your patients, they will ask you if they can see the patient before you do. They
Mm.
wrap up the communication with the patient quickly, then they present to you, and then they somehow make things easier for you in some ways. As
Yeah.
an elective rotation, they do write notes, and that you feel like they're writing good notes, they're seeing the patient, they're good assessment. An observer, they can also always help out in certain ways. And then importantly, you may not have all the knowledge that me as a myeloma specialist would.
Yeah.
So reading up on it, asking interesting questions,
Mm.
asking questions that make sense, not asking too many questions, because it consumes time with interaction.
Yeah.
I think that's helpful. And then at the same time, when you're doing that within a day or two, you should express interest in research. If you are in a major academic center,
Mm.
you're working with a physician who's known to do research, you should ask them what kind of projects they are doing, what is their interest. And if
Mm.
there is something that you've seen, that you like, that you want to be a part of, you can ask them. If it's an interesting case, you can say, hey, can I write up the report? Can I write up as a case report, and you can help me with this? But that means that you have to do a lot of the work with that.
Yeah.
And again, it's an initiative. Within a day or two, you can ask them for any projects that they may have on the table, any write-ups, any review articles. That's what I did. That's how I approached my physician that I was working in, and they were actually able to give me some few things to work on.
Mm.
But they can engage the physician and show that you are interested and you want to work with them, and I think that can go a long way.
Yeah, that also makes sense because obviously you're taking out time from your schedule to teach that student. It's only right if the student shows enough initiative and enough interest into the opportunity because obviously it's so difficult to get an opportunity in itself. So it's always important to be completely engaged. While I was doing my elective rotation, I was with Dr. Shazad Raza, and he said one thing that really stayed with me, and he said that a lot of students reach out and they make such huge mistakes in their emails and the way that they're reaching out to you that it really puts you off and you just don't reply to the email. So I think it's also because students are not probably taught how to write those emails, how to reach out in a professional and proper way. So what are some of the things that you've seen in emails that really put you off and you don't want the students to make those mistakes?
Yeah, I think that's a very good point that Dr. Raz actually made, and I fully agree with him on this. That any communication that you may have, not just with a physician, but their staff, administration, program director, program coordinator, it should actually have um, a certain structure
Yeah.
when you write it. It should be free of any spelling or
Mhm.
grammar mistakes. Um, it should actually be formal.
Yeah.
It should be concise.
Yeah.
It should give in the one or two sentences a very uh, clear glimpse of who you are, what you intend to do, and then you can attach your resume. But even the resumes that you attach, I will keep them 2 page long, not more than that. If you ever have to write like a personal statement to it, it should be only 1 page long.
Mm.
Emails by itself should not have a lot of information in there. So I get a lot of emails from all over the world, from other countries, including Pakistan and the Gulf region. And I see this mistake all the time. It's like a very long email, and I don't have like have like 100 other emails that I have to look into, so I would probably skip it. So I think being clear and focused would help. And that's important. Like not having any spelling, grammar mistakes, and errors. Being brief, be focused, be very clear would help.
Hmm. And if someone wants to follow up, for example, because obviously you're really busy, and if someone sends an email and they want to follow up after a week, what is the best way to send like a humble reminder to the doctor?
So I think timing is important. Uh, Sending a reminder in about a 2 weeks time is very appropriate,
Okay.
especially if there is some actionable items that they have asked you or you have asked them. 2 weeks is an appropriate time. And again, keeping it brief, making sure there is some context to it by responding to a previous email.
Yeah.
And then I think timing also matters a lot. Usually, a lot of physicians would not look at emails over a weekend.
Hmm.
It's not considered professional
Hmm.
mannerism if you're sending high importance emails on a weekend because you get so many of them.
Hmm.
Um, Sending them perhaps early in the week helps. Sending them perhaps earlier in the day helps because as we're starting off our days, we start off usually looking at the emails and responding to them. So I think a Monday or a Tuesday for that matter, not a Friday, not a Saturday, Sunday email, not a late day email, especially looking at the US time. Those are helpful things. And
Hmm.
again, be brief, be very precise and concise in your email. How you write it is important.
Yeah, that makes sense because we can always schedule our emails. So even if you're writing them on a Saturday or a Sunday, we can just schedule them for a Monday or Tuesday morning. Obviously, there is a huge time difference between Pakistan and the US. Because we've covered most of the things, what is some advice that you have for medical students that you would like to share over here? Any general advice that you have that you would like to share?
Of course, I think from looking back at my own my journey, my career, my transition from being a medical student in Pakistan all the way to a major academic center, myeloma specialist, cell therapy specialist in US. I think resilience, perseverance, they go a long way. Analyze, adapt, and evolve over time. Um, Hard work is important. Intelligence and your skills play a role. Your knowledge has uh, some credit as well. But what really and truly distinguishes you, especially if you want to be in academia in US, is your ability to adapt and evolve. Learn new skills, new skill sets. Learn how to communicate with people, how to network. That's very important. That's critical part of it. And then how to collaborate in a professional way where you're growing as a clinician and at the same time you are expanding your own communication skills as a person. So in our schools and our homes, growing up in that particular society, I don't think we learn to have emotional intelligence. We don't really learn how to respond to stressful situations in our life and at work. Uh, and it's important as a skill that we learn that. Going back, if I could change something, I would say that maybe I would learn a skill during the summertime when I was in med school. Maybe learn a new research methodology, learn how to write a case report, learn how to do an analysis, take some statistical analysis classes, read papers, read more manuscripts, learn how to read a manuscript, how to analyze a manuscript, so that one day you can write one. So I think those were some of the things that I didn't do as growing up and being a medical student in Pakistan, but they're becoming increasingly important, especially if you're looking for a career in academia, to have some of those professional and personal skill sets in your armamentarium.
That's great advice. And you work at one of the best cancer centers in the world. And it's in New York City, which is a dream for a lot of people. They want to live in New York. And when I came to the US in the summers for my electives, I also visited New York, although it was just a day trip, but it was so nice. So, what is it like living in New York? And what is that like? What do you love the most about New York?
So I think I grew up in Lahore,
Yeah.
and I actually have no hesitation in saying that I think Lahore is like the New York City of Pakistan. Of course, there's no comparison, but uh, what you see here at a personal level is that there's a lot of diversity when
Yeah.
it comes to the kind of experiences you can have living as a person, as a professional, when it comes to the food, the music, the art. But for me, what was more important, and again, being driven by my some of my career goals is the kind of people that you meet here, how driven, ambitious they are. Sometimes they can even be cutthroat competitive, and seeing all those shades and flavors really allows you to grow as a person. Um, New York slowly grows on you. You when you first move here, no matter where you are in your life, what phase, what profession, you do feel that you have very accomplished very little in your life. And over a period of time, everyone evolves, everyone changes. You accumulate experiences, uh, failures, successes that change you who you are as a person. And I'm a personal believer. I say that to one of my friends that every person uh, uh, should at least live for a few years in New York City in their lifetime, just to have a taste of what life can be in a city that never sleeps.
New York is really cool. I visited for a day. I wish I can live there in the future, inshallah. Thank you so much, Dr. Hashmi. Such a pleasure talking to you. I had such a great time. I hope that we can have you on the podcast again. And thank you so much for joining us. Thank you for taking out the time on a Saturday.
Same here. Thank you so much for having me here.